All right, good afternoon, everyone. I want to thank all of you for being here today. Our last and final webinar for the Night Check Calving webinar series is with Hannah DelCurto-Wyffles. Did I say Wyffles right? Or is it
Wyffles.
Wyffles? Wyffles, okay. And Hannah is a professor down at Montana State University, and she does a ton of stuff with beef. And also today we have her wonderful student, Rebekah. Rebekah is a double major at Montana State University in both animal science and English, which I wish I would have done because my English skills were not that great when I was in college. So I'm going to hand it over to these two ladies. They're going to talk about preparing for calving, in which both of them wrote a mock guide. A mock guide is a white paper that we dispense through MSU Extension. And MSU is valuable information, and I'll also include that when I send out the survey link as well. So Hannah and Rebekah, I'm going to hand it to you. I'm going to cut off my video so you don't have to look at me. Thank you so much.
Yeah, thank you. Thank you, Rose, for the invitation and for having us. We'll start sharing our slides as well. So let me make sure. How does that look? Can everyone see that?
Yep, I can see it.
Okay, wonderful. So we'll get started here, but thank you for the invitation, for having us. And as Rose mentioned, my name is Hannah DelCurto-Wyffles. I am an associate teaching professor in the Department of Animal and Range Sciences. So in this role, I get to teach a lot of classes. I teach our Intro to Animal Science class, several of our hands-on labs, and one of the courses that I also get to teach is our ANSC 215 calving management class. So through that class, we have students spend some time in the classroom learning about calving, but the bulk of the assignment is actually going out and helping producers around the state of Montana calve for 3 or 4 days during the spring. So fortunate to teach that class and be able to work with some great producers in Montana. And then of course our great students at MSU. So you were introduced to Rebekah, but Rebekah Clark is an undergraduate student here. We're fortunate she's going to graduate this spring and then come on and do her MS degree in the Animal and Range Sciences department. But Rebekah took the class last spring. And through conversations with her, she wanted to learn more about calving, but she's also still on her family's ranch and said, you know, it doesn't really make sense for me to be gone during the peak of calving season. So we worked together to create kind of another assignment for her in kind of a special topics class. And with her double major in English and her skill set, we put together this mock guide, which there we go. So I can't take any credit for this. Rebekah was really the brains behind putting this together. But encourage you guys, if you're interested, to look this up. It was published just August of this year. It has some helpful information about just things to think about as we approach calving season. Rebekah worked on this along with the help with Dr. Van Emmen, one of the beef extension specialists who I know you heard from earlier in this seminar series. So if you have the opportunity, this is a great resource to have in your back pocket as we approach calving season coming up. And we're also going to share a lot of the points in here and highlight them today as we go. So first kind of initial thought, and I share this with many classes, but it's the idea that the single most important economic consideration of a livestock enterprise is reproductive efficiency. And I've had students, you know, agree to disagree with this or argue the point, but the rationale behind this is, as a producer, you can have the best genetics for growth, for carcass traits, for milk production, but you're not going to be super profitable and be in business very long if you don't have live calves on the ground every year. So I think with this rationale going into this, just realizing how important the calving season is for all of our producers, just in their long-term longevity of their production systems, I think is really kind of keeping the big picture in mind as we move forward when talking about calving. So this process of calving, or the pathways to parturition, which is just the process of giving birth, is a fairly coordinated process. And it all starts with the fetus giving that signal. In particular, the fetus initiating the hormone cortisol. So fetal cortisol is released, and that cortisol is the stress hormone. So that fetus is growing along, it's in a pretty good environment, and eventually runs out of room, or whatever that trigger is that ultimately says, okay, it's time to go, and kicks off this cascade of events that ultimately leads to that parturition process, or the process of giving birth. So we have fetal cortisol. It stimulates placental progesterone into estrogen, which kicks off intense myometrial contractions. So this is a positive feed-forward loop that gets more and more intense, more pressure and cervical stimulation. It releases the hormone oxytocin, which oxytocin is really important for increased contractions, milk letdown. It's also helpful with bonding, so a bonding hormone. And this just, again, gets more and more intense until eventually we have the birth of that animal. We also have the hormone prostaglandin F2 alpha, which increases myometrial contractions. It increases the hormone relaxin, which does just as the name implies, it relaxes the pelvic ligament and makes it possible for this process to occur. But kind of interesting to note, it all starts with actually a signal from the fetus, particularly the stress hormone, saying, okay, it's time to get this process rolling. So scientifically, we break up this process of calving, or the stages of parturition, into 3 different phases. And understanding kind of some of those signals or things we look for in each stage is important for management, and potentially knowing when we need to intervene if that's the case. So stage 1 is actually the getting ready stage, the prep stage. So this involves cervical dilation, positioning of the fetus into the birth canal, myometrial contractions. This is that time period of getting ready. So some things we maybe look for is that cow potentially didn't come in to eat that morning. She's kind of isolating herself. Maybe she's getting up and down, just looks uncomfortable, kicking at her belly. We can see kind of a arched tail set, sunken vulva, mucus discharge. All of these things are signs that either she's in stage 1 or is probably not too far away. Stage 2 is actually the time of hard labor and expulsion of the fetus, so that actual process of giving birth. And then stage 3 is the expulsion of the placental membranes, and then subsequent uterine involution. So this is a stage that we don't always think about a ton when we think about that process of giving birth, but it is really important. We hope that these placental membranes expelled naturally. That's the goal. But if they don't within about 12 hours after calving, that's maybe when we need to do some sort of intervention, call the vet, things like that. So what are some signs that calving is close, that we are potentially moving towards stage 1, or getting close to that? And these are signs we look for just from a management standpoint. So we can see udder development. This can occur 2 to 3 weeks before calving in cows, maybe even earlier in heifers. But note that there is a lot of individual variation here. I have seen cows that bag up weeks in advance, and others that don't give you a lot of fair warning. So just something to note is there is individuality here between animals. But the teats will maybe fill and lose their wrinkles. We start to see the vulva potentially swell. And really within the last 4 to 6 days of pregnancy, the vulva should swell. We should see even more pelvic ligaments relax. And that causes the area between the tail head and the pin bones to become a little bit more loose and sunken as we get closer to that calving time point. We see mucus discharge from the vulva, swelling of the vulva, more colostrum fill the udder, so milk let down, and all of those visual signs that we talked about, those behavioral signs where she's maybe restless, getting up and down, not coming in to eat, just uncomfortable as we're getting close to that calving time frame. Stage 2 is often marked by this picture here. So once we see the water bag, certainly once we see feet, that's a sign that we're often approaching that active labor and that process of actually giving birth to the calf. So this is certainly when we're at this stage, or when we're at this time point or this picture, we're in active labor in stage 2. So the first part of the calf that should appear in a normal presentation, which we'll talk about those as we move forward, but the front feet, and then after that, abdominal contractions become more and more frequent and intense. Note sometimes that the calving process can and will slow a little bit during this time, just to give a chance for the vulva to stretch a bit, and for those hormones to do what they need to do. But the next visible part of the calf should be the nose, followed by the rest of the head, the shoulders, the chest, and then hopefully the rest of the calf. And then finally, stage 3. So this is essentially the afterbirth that's passed, or the placental membranes. Should be passed within 1 to 8 hours after calving, but certainly by that 12-hour mark. If it hasn't passed, that's maybe when we need to think about intervention or calling the vet. Essentially, what this is just the shedding of the placental membranes. So the placenta is that site of nutrient exchange between mom and fetus. And we have the caruncular portion, or that maternal portion, coming from mom, which detaches from the cotyledon portion from the fetus. And that hopefully will be just shed naturally. Note that this can again take a little bit more time, particularly based on how hard that labor is, or if the cow is really tired. But something to watch for if they haven't done this naturally within that 12-hour mark, maybe we need to look into it a little bit further. By no means is it ever recommended to just pull or yank on these placental membranes, because you think about what they're attached to. It's attached to the uterus, which is a super important organ for pregnancy. It's what houses the fetus. We want to keep it very clean, sterile, and hopefully not add any more trauma or injury to that organ, because we know if we do, it can be impactful to not only the health of the cow now, but also subsequent pregnancies as we move forward in the next reproductive cycle. So we want to do the best we can to maintain a sterile environment, reduce the trauma on that really important organ. So here's just a time course of these 3 stages and what we kind of expect here. I always tell students that animals don't read textbooks, so there is no perfect timeline, but this is just kind of an outline or a gauge of what we could potentially expect. But there's inherent individual animal variation here, so don't take this as a hard and fast rule. But for cows, maybe that first stage, 2 to 6 hours potentially, maybe a little bit longer in heifers, just because this is their first time giving birth. Their reproductive system hasn't done this before, but somewhere in this time window. Stage 2 should be relatively quick if everything is going, according to plan. And then, like I said, stage 3, hopefully it should happen within 12 hours after calving. If that's maybe when we need to think about some alternatives. All right, so I'm going to turn it over to Rebekah to talk a little bit about things to have on hand during that calving season time point to make things easier as we move into calving.
So clearly, not all facilities are going to be the same. Each operation is going to have their own setup and their own way of doing things, but there's some common practices that producers can use to help them be prepared for calving season, and then just make sure that they have both healthy moms and healthy calves. One thing that is a really good recommendation is to go ahead and do a walkthrough of your facilities before calving. You'll want to make sure that you have fresh, clean bedding, a good place for restraint, and then just a clean, dry barn. A lot of producers like using a self-catch head gate. It's an easy option, especially if you're working by yourself. A side gate can also be really helpful, not only to restrain the cow, but if you have a heifer who's maybe a little bit unsure of her calf, again, this is her first time giving birth, you can still make sure that that calf nurses and gets the colostrum that it needs while keeping yourself, the calf, and the mom safe. It's also a really good idea to make sure that you clean your pens and put down new bedding after each pair has been in there, and this is just going to contribute to making sure that both the newborn calf and the mom stay healthy. Now we'll talk a little bit about some equipment that's a good idea to have on hand. So you'll want to have stainless steel OB chains, usually 30 or 60 inch, and then handles, calf puller, disposable shoulder length plastic gloves, an OB lube, and then a common disinfectant. Having the proper equipment on hand can definitely be the difference between life and death for that calf. If you're not prepared and you don't have the equipment to help out, that could cause a lot of more complications, especially if you have a cow who's already starting to have a pretty difficult birth. And then with all this equipment, you're just going to want to make sure that you clean and sanitize both before and after you use it. And this is just going to decrease the chances of any contamination or disease transmission. It's also a good idea to have colostrum and milk replacer on hand, a colostrum supplement, electrolytes, especially if you have any weak calves, a thermometer, a suction bulb, and this is really great for calves that are maybe having a tough time breathing, and that could just be because they have some fluid in their nostrils, so you can get in there with that suction bulb and get it out. A bottle and nipple for feeding calf should you need to, as well as a stomach tube or a esophageal feeder. And all of this is just going to really help with the health and well-being of livestock. And it's also a good idea to keep all of your equipment in one single central location. That way it's easy to access and you're ready to help whenever it calls for it.
So some things to consider, and again, this is just an outline of maybe some different timelines to think about, but there is no necessarily right or wrong way to do this. Even in the calving management we teach here on campus, we go to a couple different producers' operations, and they have all different management principles when it comes to calving. So what works for one producer may not exactly fit for another, but that doesn't mean that it doesn't work. So note these are just guidelines here to think about. But generally, we want to monitor cows in labor around every 2 hours. Some people do more, some less, again, depending on their production scenario, maybe whether we're talking about heifers or cows, but just a general guideline here. Cows maybe examine if there's no progress within 30 to 60 minutes after seeing those fetal membranes. Heifers maybe give them a little bit more time because again, it's the first time that they went through this process. But no hard and fast rule, just some general guidelines to think about. So the same thing with when to intervene. Everyone has kind of different thoughts on this, and what works for one producer may not exactly fit for another, but certainly within 4 to 6 hours, if we're not actually seeing active labor, but that cow looks restless, and then maybe within a 2-hour time point, if we're actually seeing that cow showing signs of contraction, straining, certainly if we see feet, nose, those sort of things, we want to get in and intervene if we need to do so. So it's a fine line where you want to let the cow, nature take its course and let the cow do things naturally. But certainly if you see anything that is abnormal and you know that you need to intervene, I think the sooner we can do that, the better off that we are. There is research that suggests for every hour a cow is in active labor, you could possibly add a week onto the time frame for uterine involution and for her to come back into her reproductive cycle. So the longer she's in labor, the longer we see just an impact on that subsequent breeding season or reproductive cycle. Bellows has showed similar work where it doesn't just impact that cow and that calf that calving season. If we have issues at birth, it certainly can impact that cow moving into the next reproductive year. So the sooner we can get in, if we're seeing issues, if we're seeing abnormalities, the sooner we can aid in that, probably the better off that we are. So this kind of goes with that whole concept of dystocia. And dystocia is just an abnormal or difficult delivery that we may or may not require assistance, but dealing with dystocia can be really impactful to that producer's bottom line. So when we think about the amount of calves we have available for sale come that next shipping season, a couple factors come into play. And one is the amount of pregnancies and conceptions that occur. And the second is how many live calves we have on the ground during that calving season. So there's a lot of things that can impact calf survival, but one of the most important ones are dealing with dystocia. So we estimate that we lose about 3.5 million calves every year in the US, and about half of that, little less than half, is maybe due to losses that could potentially be caused by dystocia. So it is a major factor to consider, and beyond just the health and well-being of that calf, certainly can impact cow mortality and the health of the cow, as well as our cost in vet and labor bills. And then, like we mentioned, the subsequent reproductive performance moving forward for future breeding seasons. So understanding dystocia, understanding presentations can be really critical to knowing when to potentially intervene and how to help those and assist those cows moving forward. And Rebekah will talk a little bit about some of our presentations that we can see.
This is going to be what your normal calf presentation looks like. This is a really nice diagram. It does a great job of showing you all the details. So a normal calf presentation is going to be forward facing. The head and the front feet of that calf are going to be pointing towards the posterior end of the cow. A really good way to tell if the calf is presenting normally is if the hooves are pointed down towards the ground. And then typically the head is going to be resting on top of the limbs. The eyes are typically level with the calf's knees. And the majority of calves that present in a normal position don't necessarily need assistance. A lot of the time, if you do have a calf that's in a normal presentation but needs assistance, it's going to be a pretty large calf, and that's kind of going to be what the hang-up is there. But then these are some really common malpresentations that we can see. So we have a backward calf, a breech presentation, or if the calf has their head back. So a backward presentation is going to be the hind feet are what are pointing towards the posterior end of the cow. And then with this, the hooves are actually going to be pointed upward. So that's a really easy way to tell whether or not your calf is presenting properly, or if they're backward, is just look at what direction the hooves are facing. And the biggest concern when you have a backward calf is going to be making sure you can get that calf out quickly, because as they're going to come through the birth canal, the umbilical cord can actually get pinched as they're coming through, and that cuts off oxygen to the calf. And then with a breech presentation, their butt is going to be what's presenting first. There's not actually going to be any limbs in the birth canal. And then head back is usually you're going to have the front feet being presented, but their head is going to be turned back into the side. And then we'll talk a little bit about providing assistance. So it's really, really important that when you go to assist and you're getting your chains placed, you have to make sure that you're placing them properly. That's going to reduce the chances of a broken leg or an injured foot on your calf. So this is a really great picture of how you should be placing your chains, but you're basically going to loop the chain just above that lock joint and then make a half hitch right below it. And then it's a good idea to also bring your chain back over top of the toes so that the hooves are actually pulled away from the vaginal wall when you're pulling. The hooves can actually cut or cause further damage. So this is just a great way to make sure that we're not causing any more trauma to the cow. And then also make sure that, you know, we're not cutting something, and then that can also lend to possible diseases or infection in there. And another good thing to think about is when you are pulling a calf is to pull one limb at a time. This becomes especially important when you're dealing with large calves. As you can see in this diagram, you can just see that by pulling one limb at a time, how easily you can change the angle of how that calf is coming out and make it easier on both the calf and on mom. So when you're pulling one limb at a time, you'll have one limb that's going to enter the pelvis first. And once that limb enters into the pelvis and you're getting a little bit of forward traction, you can then start to apply traction on that other limb until the head of the calf appears. And then from there, you're just going to pull straight out until the chest of the calf appears, and then apply downward traction to pull out the rest of the calf. And then with backward calves, it's going to actually be a little bit similar to how you would pull out a normal presenting calf, but there's a chance you might have to push one limb back. If you're not able to do that, another good tip is that you can cross one of the limbs over the other and then pull on that lower limb. And this is actually going to help kind of rotate the calf in that birth canal and then align the calf with the widest part of the pelvis so that that calf can actually come out safely. And then with this, you're actually going to want to make sure that the tail of the calf is down too and that it doesn't get hung up. And that's just to protect the cow and make sure that you're not causing her any further damage.
So as Rebekah mentioned, the traction should generally be straight backwards until the chest kind of clears the vulva. And then we generally have traction directed more downwards towards the cow's hock. The calf then passes through the birth canal in more of a form of an arc. And the passage of the hind end of the calf can sometimes present some difficulty, and this is known as hip lock. So we know that the cervix of the cow is a fairly dynamic organ. It stretches, it dilates, and goes from the size of about your index finger to big enough to actually give birth to the calf, which is fairly amazing when you think about it. But what is more of a limiting factor oftentimes is actually the pelvic region. So that's what this picture is showing here, is just the size of that pelvic opening in relation to the hip of those calves. So sometimes when you have this situation, to aid in this process, the body of the calf can potentially be twisted at more of a 45-degree angle to decrease the diameter across the pelvis and hopefully aid in delivering that calf naturally. And of course, if you run into an issue where this can't occur, that's maybe where we need to consider calling a veterinarian. So just some other general things to think about as we move forward, and if we need to assist a cow, is certainly patience. This is easier said than done, we all know, but giving that cow time to hopefully do it naturally. This process of parturition and calving is not something that happens immediately. It takes time for the reproductive tract of that cow to dilate and time for those reproductive hormones to work. I had a student that when working cows would always say, slow down, we're in a hurry. And I always take that to heart when working with animals. Sometimes the best thing we can do is just go in, have a cup of coffee for a minute, calm down, give it a few minutes, and then get after it if we need to go in and assist and help that cow. As we mentioned OB lube, but we can use that fairly liberally because we want to make sure they make the process as easy as possible, prevent injuries, tears to those important reproductive internal organs, and also make for a healthy calf at the end of all of this. So use OB lube, work with the cow itself, and only pull when that cow is pushing or contracting. It's easier on the cow as well as the people assisting. So work with nature and those contractions and kind of let rest when they're not actively pushing. And then also be careful not to use excessive force. So just like this picture, no more than 2 men are needed, or 2 people are needed in this process. Beyond that is just extra force that's probably not necessary. You think about, you're pulling on a baby animal, a baby calf, so we want to make sure that we don't have broken legs and issues that we could potentially prevent. Also, be careful. While calf pullers are great tools, be careful when using those, because they can put a lot of extra torque and pressure on those calves beyond what a human is even capable of. So while they are great tools, they can also be something we just need to be cautious of, because they can inadvertently put a lot of pressure on that calf, cause injuries that we ideally want to avoid. And something else just to note here, that we haven't talked a ton about, but a lot of this, we need to assist when needed, but also note that some of our aid to calving is really done in the prior breeding season. So utilizing, maybe more calving-ease bulls, particularly if we know we're working with heifers or a smaller cow base, selecting hopefully a genetic line that will make our life easier during calving, using those calving-ease EPDs when warranted and what fits your production scenario will hopefully make it so maybe we don't have to assist as many, but then also being prepared and ready if we need to do so. We'll hopefully save more calves and just have a more successful calving season overall. So now we're going to talk a little bit just about, we get those live calves on the ground, what to do, and the next steps moving forward.
We'll start by talking about the postnatal care of the cow. So the first thing, and Hannah already talked about it, but it's just making sure that that placenta does pass. You're going to want to monitor your cow after labor to ensure that it does pass. And on average, they usually pass within 3 to 8 hours. But it's once we hit that 12-hour mark of the placenta not passing that we might need to look into it a little further. And this was already mentioned, but make sure that you are not trying to remove that placenta manually yourself. You can cause a lot of damage to the cow by doing that. So just go ahead and contact a veterinarian and they can help you with the next steps. You're also going to want to make sure that a prolapse doesn't occur. So there's 2 different prolapse types that can occur for a cow. There's a uterine prolapse, which is when the entire uterus is expelled. And in this scenario, you're going to want to call your vet. But then there's also a vaginal prolapse that can occur, which is when the vagina and sometimes part of the cervix is expelled. Now, these ones are a way less stressful situation in comparison to a uterine prolapse. They can actually retract and resolve on their own at times, but if you haven't seen any progress or nothing's resolved itself, again, you're going to want to contact your veterinarian for further steps. If you had a cow that had to have a C-section, you're just going to want to watch for dehydration and mastitis. Make sure she's drinking. And then you're also going to want to keep an eye on her incisions, as we can have incision complications. She could have an infection or something else occur after she's had a C-section. And then a similar thing is you want to make sure that she hasn't retained her placenta and that that placenta does pass.
So then things to consider in terms of care of the calf is, of course, to make sure the calf is breathing. So sometimes this means we need to clear mucosal membranes, make sure that they don't have anything covering their nostrils. A big one, certainly in Montana, is to try to get those calves in a clean and dry environment, and warm if necessary. So you think about the environment that those calves have been living in and developing in for the last 9 months. The internal body temperature of a cow is around 101.5 degrees Fahrenheit, and they're closer to the rumen, so it's even a little warmer. So they're coming from a 100+ degree environment and being born in the winters in Montana. And I don't need to probably describe what that can look like to anyone in the months of February, March, April. It can be a pretty tough transition and tough environment. So we want to make sure that if those calves are born, we're there quickly to be able to dry them off, get them in a warm place, because if we don't, we can see issues with just cold stress, chilled down in a matter of minutes. So this is really, really critical for calf survival in our northern climates, to be able to get them in a warm place, keep them dry during those tough weather conditions. And another thing to consider, one of our biggest considerations early on, is we want them to get up and nurse, because we would like them to get adequate colostrum intake. So colostrum, we say, is the first milk. It's a little bit different component than actual milk itself. It's full of antibodies, immune factors, high in nutrients, and this is really the jump start to immunity for those newborn calves passed from mom. So we want them to be up and nursing and get that colostrum within the first couple hours after birth. If they're not able to, for whatever reason, we may want to consider milking and tubing that calf, or having colostrum replacement of some sort on hand, just so we make sure that that calf gets adequate colostrum. The reason that we want to do that so early on is the half-life of colostrum is relatively short, so only 6 to 12 hours. And by the time we reach that 24-hour mark, the colostrum is virtually gone. So we know this is really critical to calf success moving forward. It's kind of that first jump start to immunity, and certainly a big plus to getting those calves up and going. So this is really critical to that early calf care as we move forward. So with that, that is kind of just a general overview of things to consider as we move forward towards the calving season, and we'd be happy to take any questions if anyone has any.
Thank you both for all of that. And those pictures are awesome. Does anybody have any questions about the presentation that we just heard? I was at a conference a couple weeks ago, and Dr. Ryan, who is a veterinarian out of the White Sulphur area, she has a big cow named Stella that she brings to places. And anyway, one of the fun things that I learned is that you can use a plumber, like a toilet plunger. If that calf is stuck in there, you need to push them out. I thought that was a pretty interesting tool to use as well. So I don't know, there's some really cool things out there too. My question is actually, and anybody can ask a question. There is a little chat box down there, or you can also unmute yourself and ask the question directly. But how long is that calf, like the brown fat that those calves have deposited in their bodies? How long does that last? Is it a day? Is it less than a day?
That's a great question. I don't have a perfect answer for you. And I know species are also different. So like our smaller ruminants are a little bit more prone to, cold shock and things like that. But there is the brown fat is a factor that can aid in, those calves early on and dealing with some of those harsh climates. But certainly when it's, negative whatever outside, that's beyond some of survival capabilities. So having a clean, dry, relatively warm place is really critical. So I don't have an exact set number. I think it can vary also based on maternal nutrition and calf development too. But certainly from a management standpoint, if we can aid in that, the better off we are.
Awesome. Thank you. Well, besides me, are there any other questions? And Hannah, if it's okay, may I send your contact information out with the recording just in case people have questions and they can ask you questions?
Absolutely.
Awesome. We'll give some people a little bit more time. Maybe we'll give them about a minute to see if anyone has a question. All right, well, it looks like nobody has any questions, but I'm sure around the calving season, there's going to be a couple of questions that pop up. So I will send your information onto there as well as the monk guide that you two co-wrote together. So I want to thank you very much. Thank you, Hannah and Rebekah, for spending your noon hour with us. And thank you, everybody, as well, who spent their lunch hour with us as well. So I hope everybody learned some information and can take it home with you and put it in your toolbox.
Thank you, Rose, for putting this together.
Yes,
You're
thank
welcome.
you.
Have a happy Thanksgiving, everyone.
You as well.